Ray Valek, ABC, is the president of Valek and Company, which specializes in healthcare communication. He has written extensively about healthcare quality, safety, access, and costs from the perspective of hospitals and other providers. Along with healthcare associations, accreditation organizations, public health organizations, government agencies, medical device and equipment makers, healthcare payers, medical schools, and communities affected by health disparities. Ray has won 6 IABC Gold Quill Awards. He graduated from Southern Illinois University with bachelor degrees in both journalism and speech communications.
I'm going to talk about the way that the Affordable Care Act affects us as citizens to start off. And so I want you to imagine that you decide that you're going to open your own communications company. And you're going to use a model that's commonly seen in today's healthcare system. So the first thing that you decide to do when you start your company is you decide that you're not going to be able to tell anybody what anything costs. Because they'll see the costs like after they get the bill. So that's what we're seeing right now in healthcare, is this lack of cost transparency. The second thing that you decide is that customers aren't really going to care too much about how anything costs because their communication insurance is going to pay the bill. But if you have customers that don't have communication insurance, you're going to charge them even more for your services, even though in a crisis that those costs might lead them into bankruptcy. So this is a crazy little example of how the current healthcare system works. It's not that crazy, really. We have a situation where we have very mediocre health outcomes and we have very high costs. And the Affordable Care Act was designed to address these national healthcare problems. The first problem was we have healthcare taking up 20% of the gross domestic product. Here we are right now at about 18%. If these costs continue unabated, it's going to be a disaster for the nation. I went to a talk recently that was sponsored by one of my clients, and one of the speakers said that we're going to be eating grass and berries, but at least we'll be able to get a CAT scan. But that's kind of the situation that we're up against right now. We spend over $8,000 per capita on healthcare costs right now. That's about 30 to 50% more than other industrialized countries. And so we're the line to the top and to the right, and other countries are kind of bunched beneath us. That's a collection of European and Asian countries, and Australia and New Zealand are in there as well. We have mediocre outcomes. This graph shows how much, the purple line shows how much it costs per capita, and the light blue line shows what our life expectancy is. And so you can see we're paying more money for shorter lifespans in America. And then this chart shows we're the one at the end. This chart shows a mortality amenable to healthcare, and that basically means this is conditions that can be improved with access to healthcare. Things like diabetes and heart disease, infections, stroke. And again, we have higher mortality on these measures than other nations do. So we're not really doing very well when it comes to outcomes and costs. So what the Affordable Care Act is designed to do is it's designed to basically improve our nation's performance on 4 measures. And given that we live here in Chicago, the home of the Stanley Cup champion Chicago Blackhawks, I'm sure a lot of you know what a hat trick is. Well, this is the healthcare hat trick. It's quality, safety, access, and cost efficiency. And the top 3 measures contribute to better outcomes. So if you can improve safety and quality and access, you get better health outcomes. And a health outcome would be like a lower mortality rate, or a lower incidence of disease, for example. And then the fourth one is the cost efficiency. Now, most proponents I would say all proponents of the Affordable Care Act would say that the act is going to improve the top three. And they would also probably say that it's going to be also improve the fourth one, cost efficiency. But skeptics of the law don't really believe that. They think that Obamacare may actually increase costs. But proponents believe that it'll have an impact on costs. So the central question with this act is healthcare a privilege or a right? And right now, no one is shut out of the health insurance marketplace due to pre-existing conditions. And the mandate, which has gotten a lot of media attention, makes this possible financially. Because what the mandate does is the mandate adds healthy people to the risk pool, which helps pay for people with pre-existing conditions. And so you have a pool of both healthy and sick people, and it works for everyone. So for example, when I started my own business 10 years ago, I tried to get individual health insurance, and I was turned down by one company, and then another company insured me with a catch. And that was because I had to accept a coverage exclusion for a year where I wasn't going to get any benefits for respiratory disease for a year, and it was because I had allergies to ragweed and dust mites. And so pre-existing conditions affect you. You may think you're healthy, especially if you're over 40, there's a good chance that they would find something in your medical background that would preclude you from getting insurance. And the Affordable Care Act basically makes that impossible now. They can't do that anymore. So this slide basically puts the cost of the Affordable Care Act in perspective. Over the next 10 years, projection of the cost of the Affordable Care Act is $1.36 trillion. That's in comparison to a $40 trillion cost of the healthcare economy. So this investment, for example, it's like having a $200,000 house and deciding to put $6,800 into your house to improve your house. Or it's like having a $1 billion company and deciding to put, what is it, like 25 million or 28 million, in an effort to transform the company. So it's a steep cost, but it's not something that's outside the realm of reason. The Affordable Care Act is not the whale that came and ate up the health insurance, the health care industry. It's a pretty small piece of the pie. So what it really comes down to, and I know it's a little bit counterintuitive, but it comes down to it's all about creating health. The Affordable Care Act is designed to create better outcomes. And better outcomes basically mean that we have healthier, more productive Americans that contribute economically, they pay taxes, and they increase government revenue. And lower costs, because healthy people will spend less on health care and slow the rising costs of Medicare and Medicaid. So you have a system that is designed to make America healthy while also reducing costs. And time will tell whether we're successful in doing that. But that's kind of like where we are right now with the Affordable Care Act. So with that, I'll hand it over to Jim.
For 25 years, Jim Duffett has served as Executive Director for the Campaign for Better Healthcare. Currently, they are the leading organization in educating Illinois residents about the Affordable Care Act and the Illinois health insurance marketplace. Some of Jim's accomplishments as a consumer advocate include banning door-to-door solicitation by the insurance industry for Medicaid managed care plans, ending several Medicaid discrimination practices, enacting a Consumer Managed Care Bill of Rights and Illinois All Kids program, passing the Healthcare Justice Act, and leading the Illinois effort to pass the Affordable Care Act. Jim has an International Affairs Master's of Arts degree from the University of Pittsburgh.
Hi. I wear the hat of the Illinois Campaign for Better Healthcare. It's a statewide coalition of well over 300 very diverse organizations, groups representing people with disabilities, senior citizens, small businesses, a wide range of providers. And we do believe that healthcare is a right and not a privilege. And we've been around since 1989 fighting for that. Obamacare isn't perfect. There's not one piece of legislation in the history of this country that ever passed that was perfect. And our theme from now on is inform. We've got to do a lot of informing to people so they understand that there's no death panels, there's no computer chips that are put in your arm. So when you go in, you can scan like at the grocery store. Women who sign up for Obamacare do not have to get a physical exam by Uncle Sam. If any of you saw what was been going around on YouTube in a couple weeks, very denigrating not only to women but also lying about Obamacare. We have to implement, and I'm going to talk a little bit about implementation, and we have to improve. There's no doubt that there's further improvement. These are the values that we believe in, and we believe what Obamacare will begin to do is begin to put control in our hands, that no longer the insurance industry is going to be able to control our decisions. We're going to have choices. We're going to have financial security. The number one cause of bankruptcy in this country is because of medical costs. That's off the table, even though I would say that we still believe the subsidies that people are getting in out-of-pocket costs are still a bit high for low-income people. Peace of mind. We also run a helpline and numerous stories. And now finally people are going to have a peace of mind that, you know, you get cancer and you're uninsured. You're not out of luck. You'll be able to get access to care to be able to help that. Personal responsibility, and it goes earlier to Ray's comment about the individual mandate that's there, that we believe that everyone should take personal responsibility, whether you're an individual or a company, and provide health insurance to your employees. Why should a big box company that moves into a town doesn't provide health insurance to its workers and small businesses located in your town who've been around for 10, 20, 30, 40, 50 years who believe in providing health insurance to their workers? Why should they be held at a disadvantage, and why should they pass those costs? This is what we get now. No discrimination against kids with pre-existing conditions, asthma, acne. I mean, Illinois ranks second in the country in terms of insurance can drop you if you get sick, which is called rescissions. California's number one. We had a case that somebody came and they had put their street, instead of putting the word street, 903 South Anderson Street, they put 903 South Anderson Avenue, and one of their family members had cancer, and the insurance company here in Illinois said they lied on their application and rescinded their coverage. Needless to say, totally freaked out the family. We helped in that case with the Department of Insurance and forced the insurer to come back and pick up all the coverage. No lifetime coverage. You know, we all get $1 million coverage. We think, my God, $1 million? Are we going to spend it? Good luck. If you get crossing the street, somebody goes through a red light, you get hit. That can go like that. A lot of people, reach that limit that is no longer there. A lot of preventive services. Insurers now have to be responsible. Last year, 179,000 Illinois families received nearly $10 million in rebates. If an insurer doesn't pay at least 80 cents of every dollar, if you're in the individual market or small group market for health care, then you get a check back. I know our organization got $148 back because of that. Not much, but it adds a little accountability. Small businesses are getting premiums. Senior citizens are getting rebates on their whole Medicare Part D. Medicare only pays so much, and then you get into this big hole that you have to pay out of your pocket, and then Medicare will pick up little by little. That is decreasing. Physical examinations on Medicare. We can spend a whole day about the truth of what Obamacare does on Medicare. It doesn't cut Medicare. It improves the quality and gives senior citizens more resources. There's also a high-risk pool for people. Young adults can stay on their parents' insurance. A variety of new workforce opportunities for young adults. Anybody who wants to go back in the medical field, that there'll definitely be more opportunities there. What do we have to look forward to come January 1st? Definitely Currently right now, women pay 2-3 times more for health insurance than men. That discrimination is no longer going to happen. There will be caps on out-of-pocket costs. No pre-existing conditions for people 19 and older. Small businesses are going to be able to get up to 50% of tax credits if they're meet certain criteria. More benefits for seniors, disability community, accountability of insurance. I mean, there's a lot more benefits out there, a lot more consumer protections than for those of us who have insurance may think that this doesn't benefit me at all. Well, it will. You can't be discriminated against because you're a woman. The caps on out-of-pocket costs are going to be there. Insurers can't take away your health insurance. So there's a lot of benefits that many of us will never experience in our lives at all. But at least they're going to be there, and I think many of our friends will definitely be experiencing that. So where is Illinois right now? In the setting up of Obamacare, and you hear about the word exchange, we use the word marketplace. We think it's a fairer word than exchange. Exchange is what am I giving up to get something, and this is actually a marketplace. All the plans that are being sold in the marketplace are private, they're not public, and so states had the opportunity of either letting the federal government do that or setting up their own marketplace. We advocate, and you'll see a slide later about setting up your own marketplace. And then over the past previous year, the federal government decided to set up a state-federal partnership. So that's what Illinois is doing. The state hopes in 2015 to move forward with a state marketplace, and you'll see a slide later, and folks will be getting these slides. There's a lot more power than we have as a state if we have a state marketplace. There's more tweaks that we can do to the marketplace if we had a state marketplace. But legislation needs to happen, and we did push legislation, but it passed the Senate, but Speaker Madigan killed it in the House. Kind of the deadlines, you can see kind of where things are at. This is where we are right now in the beginning of October, and then you can see if we decide to do a state marketplace, these are different timelines that we're going to have to do. If we move forward with the state marketplace, that has to happen by the end of this year. So this kind of gives you a good assessment of, so what's the exchange going to provide, or the marketplace going to provide you? So this gives you an idea right now, here in Illinois, all the benefits that people are currently getting that the state has. And also in green here, other benefits that people are going to get. This is everyone who's going to be eligible for the marketplace right here. So these are folks at different economic levels, children over 300%, on and on. Plus it goes up higher. I believe there's probably going to be about, out of the 1.2 million people that will be eligible in Illinois to get into the marketplace, there's about 15% of them that are above 400% of poverty. And just to give you an idea, for one person, it's about $46,000. For a family of four, it's about $95,000. If you are above that level, you can't get any financial assistance, which I'll show you more. And then here are our friends who are not legal citizens yet here in Illinois. There's about 200 to 250,000 of those folks in Illinois that are not going to be able to get insurance. They'll still have to use the emergency room to get health care. Though some of them, if they do have the means, can buy in the marketplace, but they will not be getting any subsidies at all. This just kind of gives an idea about what the marketplace is. It's a place that right now there's 165 plans, and the state's divided into 13 different regions. And you'll see a map there that people will be able to go in and shop and compare apples to apples. There's different calculators that people will be able to go in and calculate what level of assistance that they may be able to get. These are all private plans. Again, when I talk about Obamacare not being perfect, we advocated what was called a public option. We strongly believe that there needed to be some additional competition in the marketplace. And then there's a lot of studies, Rand Corporation, that just showed the impact that this is going to have on businesses here. And this gives you an idea. You hear a lot about the different level plans, bronze, silver, gold, platinum. This just basically means, what the, if you are at 60%, your employer insurer who insures you would pay that amount. You'd be responsible for the other 40%, and also out-of-pocket costs. You'll be paying more in out-of-pocket if you decide to do the bronze plan. But of course, the bronze plan and the premium is going to be a lot cheaper than platinum, but you know you're going to face less out-of-pocket costs. And I have one graph, one thing that unfortunately we won't be able to go into. This goes into kind of what I was saying. It's an estimated policy holder's responsibility and then the estimated insurer's responsibility. So when you hear those terms, that gives you an idea of what that means. And then definitely key considerations for anybody looking to get into the marketplace. Oops, I just missed that. You know, you gotta look at the price, look at how much you can handle out of pocket, look at the network, because that's the other important thing for you to see. You know, is a physician you would like to go to, or a provider or hospital in your town that you would like to see. You're going to have to be able to judge that too, because that provider network is also important. This is just an example, and unfortunately we won't have time to go into it, but everybody will see a copy of it. You can see Jane's different options that she ends up having, how much her deductible is going to be if she, depending on her income, how much deductible doing inpatient and physician visits, and then what's her bottom out-of-pocket cost. So that gives you a good idea. I mean, we all take chances. We don't think we're going to get sick. Maybe the bronze is a better plan to take. If you feel like you really need to utilize the healthcare system, you're going to have to kind of balance out how much more you're going to be paying for a platinum plan, but your out-of-pocket costs are going to be minimal. Those are choices that people are going to get, good or bad. Those are choices. People will be able to sit around the table to do it. This is, as of last Thursday, the first 36 hours, over 100,000 Illinoisans went to the state website and went to see what was going on. About 704,000 pages were actually looked at the website. It just breaks down more data. I know we've all heard about the problems that are happening with the federal website because in Illinois, if you're eligible for Medicaid, which is about $16,000, there's about, I think I've heard about 11,000 people who have already signed up for the Medicaid program last week, but those that are above it have not been able to sign into the marketplace. And is that good or bad? Sure, we'd like it all to work perfect. The big issue for people to remember, and as you talk to friends, is whether you were able to sign up today, next week, October 15th, November 10th, November 30th, December 10th, your health care won't start until January 1st. The real target date for people to remember is December 15th. If you do not register by December 15th, you will not be able to get health insurance that starts in January 1st. You sign up after December 15th, then it will start February 1st, and it goes, open enrollment goes all the way through March. And we feel pretty confident, at least what I've been seeing this morning, that we are getting, the federal website is working much better. People are getting in. I will say those states that have had a state marketplace are signing up quicker than a situation that Illinois is. This just gives you an idea of the options that people are going to have. The number of companies, and though the number of companies, they may each offer 4 different silver plans, 5 different bronze plans. There's a variety of plans. Though I do want to say, and I don't think I have a slide here, is that there's a bottom line essential health benefits. So just for people to understand that if you got into bronze, you're not going to get snake oil health care. And you have to get platinum to be able to get a real good health care plan. There is a set level of benefits that everyone's going to get, whether it's a bronze plan or whether it's a platinum plan. The big difference, again, a bronze, silver, gold, and platinum is the amount of money that you're going to have to pay or your employer for insurance, and then how much you want to pay out of pocket. And now each of those plans, there can be other whistles and bells that an insurer may want to add more benefits to it. But I want to make it clear, just because you sign up for a bronze plan, you're going to get a good level of benefits. I mean, we're very pleased with that. This just gives you an idea of the different regions, about the different choices, how many plans. Cook County, we're going to have over 100 plans to be able to choose from. This just talks a little bit about small businesses. 96 of all businesses are exempt from any requirement. 50 or below, you can just kind of play that out. You can see those businesses that are more than 50, the vast majority of them end up providing health insurance, and a few don't. And and even though small businesses at least have the opportunity to now go and shop for insurance, and they won't be stuck having to pay 15-20% more than they currently do versus a larger employer. Just some more information about tax credits that small businesses are going to be able to get, and not-for-profits. We're a not-for-profit. We can get 25% of, there's a calculation that you have to put. And even though we don't pay taxes, we will get a check, and we did get one check already for $1,800 back because of we meet certain guidelines to get that tax credit. That paid for a computer, and it paid for 2 monitors and a video camera also. So it does have an impact here. This talks a little bit more about the business tax credit. There's jobs. Obamacare does a lot of things. We understand that there's going to be more people into the system. We've got to make sure that there are more advanced practice nurses, more physician assistants, more RNs, more this, more that. And so there are a lot of programs that have started to kick in over the years to make sure loan forgiveness programs, a lot more opportunity for people. For retirees who are not yet 65, the marketplace, you can buy into it depending on your income. You can also be able to get premium assistance. But if you have ongoing health care coverage and you're not 65, you're okay. And then this just talks about Medicare, that in fact there's a lot more preventive services for senior citizens. When you hit 70, you're not going to be kicked out of the Medicare program at all, but there's a lot of other key benefits there. I talked about personal responsibility, and these are the fees that you're going to have to pay. Rate shock, I call it now rate crock. We were hearing a lot of lies that cost for insurance is going to be 50-75% higher. They're not. They're coming in 25% lower, if not even more. Delays, the employer responsibility has been delayed. It affects about 200,000 individuals throughout the country. Not a big thing. Needless to say, we were not happy about it, but those folks at least will still be able to get access into the Medicaid. I'm not going to go into this. This kind of gives you an idea, but I was talking about the reason we need a state market here. And there's different ways you can get an active purchaser who has the ability to be more aggressive in limiting the number of plans, negotiating the price of what insurers are going to be providing. I mean, our goal overall is making sure that there's strong families, a secure middle class, a better world for our kids. And we think Obamacare does meet a lot of those. Freedom and justice, personal responsibility, definitely our kids definitely deserve a better world to be able to be covered. One thing I do just want to stress in ending is in Illinois right now, we do not have the ability to negotiate with insurers costs. And at least, whether you like the Illinois Commerce Commission or not, when the utility companies want to come forward with a rate increase, there's at least a public process that you can go through. A public process that you can vet your opposition, that the utility companies have to provide the Illinois Commerce Commission with information to justify their rates. Here in Illinois, in terms of the insurance industry, there's none of that at all. They put their rates out there. You hear the issue of competition. Frankly, in our view, we don't think there's that much competition here in the state, and we believe that by having a state-based marketplace would give us the ability to at least negotiate rates with insurers. So I apologize. I went over my time and spoke pretty fast, but we will have an opportunity for more questions there.
Lindsay Resnick is the Chief Marketing Officer for Health Services with the KBM Group. They advise healthcare providers and payers on the implications of the Affordable Care Act, focusing on how to thrive in the new healthcare landscape. Lindsay has held senior executive marketing roles at Gorman Health Group, Health Market, Radix Health Connection, and Celtic Life Insurance. Early in his career, Lindsay worked for the Blue Cross Blue Shield Association, the Massachusetts Department of Public Health, and Massachusetts General Hospital. He holds a master's degree in health administration from Washington University in St. Louis.
What I'm going to try to do is put some, just level set a little bit and talk a little bit about who's this most important for the customer. People that you have to communicate with, whether they're employees, whether it's others in the community that you want to educate. So let me just, big picture, there's a tremendous amount going on right now, not just in terms of the Affordable Care Act. I'm going to talk a little bit about just healthcare in general in this country, and as consumers, what we're facing. The issues around reforms, we're seeing new competitors pop up. You're going to hear a term called accountable care organizations, where providers are now putting some skin in the game in terms of the outcomes that they produce. So we heard earlier about outcomes-based, performance-based payment. So physicians, for example, are getting incented or disincented based on if someone gets readmitted to a hospital or not. There's healthcare reform or not, there's still pressure on the cost of care, as we've seen demonstrated earlier in this country, at $2.6 trillion annually. And then the amount of change that's going on in marketing and communications today and outreach. I'm going to talk a little bit about that, because that really puts some of this in context. So, quick national statistics, pared down, the same magnitude of these numbers take place in Illinois. You have about 100 million people that are categorized as obese in this country. 45 million still smoke. 26 million people have diabetes. And the scary number is there's 79 million with quote-unquote pre-diabetes. Now, a lot of that is tied back to obesity. You have 20 million people on statins. So you have all these healthcare issues. You have about 65 million people, particularly in rural areas in this country, that don't have access to a primary care physician. You have 50 million people in this country. Think about it. Where we are in our nation, 50 million people don't have immediate access to a dentist. So big, about 37 million hospitalizations, and the number that's out there, about 65 million people have a pre-existing condition. So where they would go to an insurance company without an employer-employee relationship and try to buy individual health insurance, they could get rejected, or they could get their respiratory ailment, what's called in the insurance lingo, ridered out, excluded from coverage. So that's sort of a healthcare picture. Just to put in some context where people get their insurance today, about 91 million people get it from their employer, and those employers self-fund. So they may carry a Blue Cross Blue Shield card, but it's really access to the Blue Cross Blue Shield network, and Blue Cross Blue Shield does the administration. The company is putting a pile of money aside every year to pay for health, pay for benefits. So they are self-funding that. Then you have about 52 million that are fully insured with an insurance company taking all the risk. You have about 18 million in small employers in the under 50 market. And I'm going to talk a little bit, that's an important number to talk about that in a minute. About 14 million people today buy their insurance without an employer-employee relationship. They're just going to a health insurer and getting health insurance. About 45 million on Medicaid, 45 million on Medicare, and 49 million uninsured. Of that 49 million uninsured, just to round out, you probably have 10 million that are categorized as illegal aliens. You probably have 10 million in this country that could qualify for Medicaid, but don't know how or are not applying. You have about 10 million that have just made the conscious decision they'd rather buy a flat screen TV and not pay money for health insurance. Many of that young adults who are paying college debt, whose mobile phone and credit card is more important to them And then you have people who have tried to buy insurance and cannot. So, you know, it's a complex number. By 2016, the guesstimate out there is that 24 million people, primarily from this group and this group, are going to be buying their insurance on exchanges or marketplaces, as they're called here in Illinois. This is important because think of yourself, just for a minute, leave all this stuff behind. As healthcare consumers, it's very complicated today. There's a lot of decisions of, you know, even if you're at a large employer, and someone's here from Aon, those employees have to make benefit decisions about the level of deductible, whether they take the big network that's offered or a product that may be a little less, but it only has Northwestern Hospital, it doesn't have UFC and Rush in there, or vice versa. So there's decisions like that. Consumers are making decisions whether they should have insurance or not have insurance. There are these things out there called health savings account, health reimbursement accounts, FSAs. When someone turns 65, there's now choices of just signing up for Medicare, signing up with Medicare and joining a Medicare Advantage plan, signing up for Medicare and getting a supplement to that, a Medigap policy, a Medicare supplement. So there's a lot of financial decisions. And then if you turn to the healthcare decisions we're facing, they're getting more and more complex, and more of that is falling on our shoulders as consumers. So, you know, you sprain your ankle over the weekend, do you go to the emergency room, do you wait till Monday and go to your physician who you know just opening the door is going to cost you $150 for an office visit? Do you go to that retail clinic you've seen inside Walgreens, Costco, or CVS to have them look at it? Or you just self-diagnose on the web as best you can by looking up medical information. And now, there are services out there that many employees have, that one is called Teledoc, where you can call up and automatically speak to a doctor. You'll speak to a doctor. And there's more and more services popping up where you can online chat with a physician. So you have clinical issues, you have this whole industry that's popping up called medical tourism, where you can stay here and get a knee replacement for $50,000, or go overseas and get it for $6,000. You have some consumers today getting a letter in their mail from the primary care physician, and you open it up and it says, if you want to continue to be seen by my practice, you now have to pay a $2,500 a year membership fee to be part of my practice. Well, for Medicare, it's called concierge medicine. And what those physicians are trying to do is limit the number of patients they see. They're going to give you their mobile phone number, they're going to give you high-end service, but you're going to have to pay a membership fee to be part of that. And think about seniors on a fixed income. My point of all this is there's a lot of options, there's a lot of decisions. Lay health reform on this. And we're in a squeeze. Healthcare is a very complex set of decisions that consumers have to make. For everybody who likes a picture, this is sort of the picture of exchanges. You go through, it's like a shopping mall to see what you're eligible for, if you have employer-based coverage, if you can get a public subsidy, if you're in a children's CHIP plan or Medicaid, or none of those, you can go shop and compare in the exchange. And this is 2019, 29 million people going through public exchanges. I'm not even going to talk about private exchanges right now. Majority of people that are in that 49 million are eligible for a subsidy. Many of them are previously uninsured, and I'm going to talk about that in a second. Particularly those small groups, so let's say groups certainly under 20, are really going to use this as a way to get out of the insurance business. So an employer who owns, a bookstore or a small consulting firm is likely to get out of the insurance business and send employees to shop on the marketplace or the exchange. One of the things this means is there's a whole set of new kinds of categories and market segments. So I do a lot of work with health insurance companies, and they're all analyzing the data to try to learn as much as they can about these different segments. You're going to have employees who all of a sudden are abandoned by their small employer to go shop for coverage. You're going to have some employees that think they can get a better deal by shopping in the marketplace or on an exchange. You're going to have people who have been uninsured or have previously been rejected for coverage. So what I call them is pre-existing time bombs. These people are sick, but they've never been able to have coverage. Now they're going to enter the risk pool and be eligible for insurance. You have millennials, so you have a large population of people who are now covered under their parents' plan up to age 26. What do they do 27, 28, 29? Are they going to get insurance? Are they going to see the economic value of insurance in their lives? So there's a lot of migration taking place, and that's going to take place over the next 2 or 3 years. One of the issues that a lot of people are staying away from right now is, let's say, so the Affordable Care Act is saying 24 of the uninsured, let's say just 15 million sign up. That's 15 million entering the insurance, the provider system, many of which who haven't had health insurance for 2 or 3 years. So they haven't been going for preventive services. They haven't been having mammograms, colonoscopies. You're going to see a lot of pressure on the primary care delivery system in this country, which is already stretched to a limit. And how are we going to deal with that? I mean, look, some of these numbers are pretty scary. A woman with insurance is 75% likely between 40 and 60 who haven't had an annual mammogram in the past 2 years. That number drops to 38% for the uninsured. Same thing with colonoscopies. So it is an issue when you have all these people that maybe for the first time or the first time in 2 or 3 years have a shiny new insurance card, they're going to use it. So we have to be prepared as a system to be able to deal with that. Now let's talk a little bit about the communication aspect of this. Some big hairy numbers out there. You have 108 million people going online with Amazon every month. 3 million emails per second. 1 billion people on Facebook. If Facebook was a country, it would be the 3rd largest country in the world. You have someone between age of 18 and 24 averages 110 texts per year. About 90 million tablets will be in the market next year. About 63, probably numbers up about 70 now, million people are comfortable doing all their banking online. So this myth that people aren't going to go shop for health insurance online is a myth. People are comfortable, they're going to do it. And I think these numbers, why I throw them out there, really is to make the point that if you're in the communication business, you have to be thinking about all the people that you're communicating with and what they're most likely, what their customer journey is, how they go and look for information. So one example, I do a lot of work with companies that market Medicare insurance to seniors. Well, that over the last 5 years, that's changed dramatically as we try to market a Medicare policy to a 65-year-old. That's the first year you're eligible for Medicare. Well, they don't want to get a piece of mail. They want to go online, and if you're not in that first 5 searches online, you're going to be missed by the first time that 64 and a half or 65-year-old shop. Same thing as I mentioned earlier with millennials. You're going to need to talk to people where they want to be talked to. And marketing and communication has changed from a one-way dialogue to opening yourself up to create a conversation with people, whether that's employees you're communicating with or it's direct to consumer in the open market that you're communicating with. It's essential to be able to start that dialogue. And what's your social media strategy around health reform? What is your direct mail strategy you may have one? What's your texting strategy? So there's a lot of things to think about in segmentation. What's your multicultural strategy? Where do you want to be out in the community from a grassroots standpoint? A lot of options. A lot of this is based on what you know about who you're communicating with, and are you informing that with some of the big data that's out there. We could have a whole other conversation about using demographic information and using psychographic, lifestyle, social media information, online meeting, what kind of device do people carry, what are they doing on that device, all that information available to inform outreach. And then lastly, I'd say that you have to think about making that communication of value to the individual. In other words, putting yourself in the shoes of who you're talking about, whether that's a prospective customer or whether it's an employee or whether it is a community that you want to talk to. How do you make it about them? How do you move it from just talking about features and open-ended, and explaining the inner workings of a marketplace or exchange is going to be very difficult, and it's going to create a very complex conversation that is going to be tough. But explaining to somebody how it affects them and what their options are and what they need to do, where they need to do it, when they need to do it, is a lot more beneficial from a guidance, from a value standpoint, and it gets at that question of what's in it for me. Making sure you've answered that question for the end user, whoever that may be in your audience, is going to be critical, whether it's around, this is sort of my go-to marketing communication slide in terms of going direct to the consumer on anything. On the Affordable Care Act, it certainly is applicable to be able to answer those questions of how it affects somebody, what they may be eligible for, what's in it for them, and then be instructive on what they need to do. So with that, here's my contact information. If you have any questions, I put a lot of this out on a blog, and you can follow me on Twitter. Pretty active out there on this issue and a lot of marketing communications issues as well. Thank you, everybody. I don't know if we have time for questions, but I'd be glad to stay a little bit and chat one-on-one, or we can take questions as a group.
I heard something this weekend that said there's only going to be, and when the graphic showed, 6 insurance companies offering coverage in Illinois, and based on the information you guys just presented, it sounds like those insurers have decided that this actuarial game that we're going to play with insurance, and only 6 of them feel like it's a good enough bet to get involved. Is that going to be similar across the whole U.S., that insurance companies are going to say, hey, I don't want to play this game? And
so just to put that in some context, 100 million people in the U.S. are covered by Blue Cross and Blue Shield plan. The next 100 million people are covered by 10 of the next 10 insurance companies. So when we look at that, there are 6, so Blue Cross is a player here, so that's 1. And then half of the next big batch, although you have some little plans, you have a new co-op plan, the Land of Lincoln Company that's here. A lot of the big players have looked at these markets and said, I'm not sure it's ready for prime time, we're going to sit out a year. So I anticipate that in year 2, year 3 of this thing, you may see some others jump in. But I would say, if you look at Illinois healthcare, maybe you know this statistic, Illinois health insurance coverage today, that 80% of people are covered by 5 companies.
The other
In the state.
context, the other context I would put to that is most employer plans have one company to choose from. And some of them may have options with one company, but many of them only have one option with one company. So when you say only 6 plans, that's more options than most people have right now.
And I think I think Blue Cross has 69% of the market in Illinois, and if you add Cigna, I think Cigna has 7-8%. So it's like you have 2 insurers who are insuring close to 78% of the Illinois market.
Right, and then United Healthcare and Aetna would probably get you to 90.
Right. Connie left a question, Lindsay. Any tips for communicating the complexities of the ACA to clients, members, and employees?
Well, I go back to that last slide. Don't try to boil the ocean. You know, there are some basic things that people need to do and assess their personal situation that's relatively easy to guide them. You know, and the other thing is I would stage it, I would sequence it. You don't have to do everything at once. A lot of the components have dripped in over the last 3 years. This October 1st date was a big first date, no question, because the marketplace is open and it meant now for the first time with pre-existing conditions and limited rate bands. So, you know, it used to be that the most healthiest person could get rate number 1 and the least healthiest, oldest female maybe could get rate number 7. Well, now that's only rate 1 and rate 3. Rate up is rate 1, 2, and 3. That's it. So a lot of this stuff has fallen into place. And you know, you mentioned earlier, the reason it's open now is so people can get coverage starting January 1st. This open enrollment period now lasts through March 31st. So there's no rush, and I think my assessment is that part of the reason we haven't been seeing a huge amount of advertising and education. I sort of think the Obama administration knew they weren't quite ready from a technology standpoint. They still are sitting on some money to advertise this thing. And I think that we'll pace it out now to get this more known and more known and more known. And as I said, we do a lot of work with insurance companies, and I know we're working with companies on specific strategies on how do you get to those millennials? How do you get to the 27, 28, 29-year-olds? One thing we're having great success with is getting to their parents, because that's who they're going to turn to once they get kicked off their parents' policy. Well, what do I do now, Dad? And you know, so there's a range of those kinds of strategies. That's why I think data and segmentation gets to be really important.
And to add to, you know, the example we use to people, it's like when you go buy an automobile. Do you walk in the first car lot and immediately purchase that car? You don't. You know, you check it out, you go to a couple other ones, you go online, you look. It's a big investment that you make. I think your comment about I know the media firm that the state has hired, they're purposely not doing much advertisement at all during the month of October. Precisely, let's work out the kinks. Let's figure out, you know, what do we need to do, and then you will definitely see a major uptick come November, because the real target is December 15th. And then you'll end up seeing probably another uptick probably in January and February as more people who are experienced getting care, understanding that they can do it and it's fine. You'll start to see, see that increase. In terms of young adults, I think it's a fascinating example. And there was something I was reading last week that when Romney Care started in Massachusetts, there were 24 or 27% of the uninsured were young adults under 26. And within 2 years, that figure went down to 4.5%. So there was definitely an increase of young adults, while there is a feeling that young adults won't get into the mix of stuff, that they are. They do want. And RAND, this was an old study that RAND made that said that 4% of young adults, and this was like an 07 or 09 study, purposely did not want to get health insurance because they'd rather spend their money on other things. So I think in that...
Well, if you combine that with, you can't pick up a paper every other day and read about unemployment in the millennial sector.
Right.
First of all, they probably qualify for a nice healthy subsidy, but they have college debt. They can't live without a phone. What's the statistic? I think it's that 70% of millennials sleep with their phone. And so, they're getting started. They have other issues, and they're invincible. So why get insurance? The other point I wanted to make to Ed's question about, 6 insurance companies, the flip side of it, and no one wants to wear the hat of the insurance company, but this is a public-private partnership. So early on in the debate, a public option, sort of Medicaid for non-Medicaid people, was taken off the table. Private health insurance companies are those 6 companies. Now, probably of those 6 in this state, 3 are not for profit. But 3 are for profit. And they don't know what they're going to get come all this open enrollment. And they have many of them have shareholders, and they have margins to make. And they're not public sector entities. So some are just being very cautious to know, okay, now I can't take pre-existing, I have to take everybody who shows up in my door. That's a new rule for me. The pricing has changed. That's a new rule for me. So they're sort of reworking their own actuarial and underwriting models in terms of risk assessment. And that's going to take a little time as well.
Although I've noticed that Blue Cross is out there advertising pretty heavily already, because they know that they're in it to stay.
Yeah, they're going to get a big chunk of the money.
They want to get everybody before they have more options.
Mm-hmm. Yeah, I was just thinking, understanding that we have an accelerated timeline between now and March 31st, which seems like it's far away, but in actuality it's not. There's obviously a very large education curve that's going to be taking place. What are the insurance companies doing to position themselves in the most positive light? And then to kind of go back to something we touched on earlier, what is your understanding of how the Obama administration is going to be getting that information out there? Because I know I've learned a lot today, and have
Well, there's
followed
navigators,
this.
and,
Right.
and there's in-person counselors, which there were 44 groups that was federal dollars that came in, and then you had to go through a whole process. So there's 44 groups who have in-person counselors, which is a very detailed training. And I know for us, our focus is community colleges, small businesses, and communities of faith, and that we're doing heavy education. I think you're absolutely correct. There's a large percentage that are going to be able to go online. Has added frustration in the last week that people can only go about 3/4 to 3/4 of the way online. I think today I got a couple emails that people here in Illinois were able to go through the whole process and look at the different plans. So that's one thing. I think, as you mentioned too, about the media campaign, you're not only going to see an intense media campaign happening from the state, but there'll also be, some from the Obama administration ads, and then Blue Cross Blue Shield. I'm in Champaign. I mean, and they're doing public hearings all around the state, and they're advertising pretty regularly.
Yeah, so we don't happen to work with the Illinois Blues or with particular Terry, Illinois, but other states where we're working with one of the 3 top market share companies, we're doing the whole range of direct-to-consumer marketing, starting with understanding who the uninsured population is.
Right.
So we have the ability to run them through an index to know which ones are subsidy eligible and which are not. And then a whole range of communication vehicles, from television spots to town hall live meetings, town hall virtuals, the whole range of grassroots, some direct mail, like I said, direct mail to millennials' parents, whether we're aging off. We wouldn't send direct mail through millennial text campaigns. So you're really seeing,
Mobilize for it.
Yeah.
that's right.
The other thing I would say in response, oh, I'm sorry, go ahead.
Are companies also taking a wait-and-see approach? Because, as you guys said, the information is trickling out slowly from administration, so we can't give it out any faster because it's coming slowly from the government. So are companies also, the ones you mentioned that are fully funded or self-funded, are they taking a wait-and-see approach as well? Because I'm not sure I understand the logic of them continuing to offer insurance to their employees if the government's going to do it. They want to cut costs to hit the
Well,
market.
I was going to say that. I think one of the important messages that from an employee communication standpoint is that employees need to know that their skin is in the game now, and it cuts both ways. They get more options in the marketplace, sure, but they're also going to pay more every year if they don't stay healthy. And so anything that a company can do to promote, wellness programs, disease management programs, ways that they're working with employees to improve their health, yoga classes, Pilates classes, whatever. And employees also need to know that they need to engage with their doctors and work with them and listen to what their doctor tells them and have a conversation so they can become a healthier person. And I don't know if that some of that's going to come from the plans, but I think some of that has to come from employers too.
So the 160 million or so people covered by, let's say, large employer, over 50, that system isn't going to go away. Will there be some changes? Yeah, and it sort of gets into this whole other conversation. Many of them are going to what's being termed out there private exchanges, where they're getting a defined contribution to their health benefits and can go on an exchange that the employer has arranged and buy a particular plan option. So, and employee benefits for many companies are a big selling point. And employers pay 25, 30, 40, 50. It's rare these days. And if you're with a company that pays 100%, God bless you. But so the employer-based benefit system is not going away, I don't believe, in this country. And a lot of this stuff doesn't affect those companies. A lot of them who were affected, that's the 1 year delay that Obama put in place a couple of months ago.
I can't think of it's a benefit health plan based on London, and I think it's international health benefit plans, but this was a August report, and they interviewed, I think it was like 4,000 US companies, and like 93.7% said they don't plan to do anything, and 1% said most definitely we plan to dump our employees onto something, and then the other percent said, we're just going to kind of assess what's going on there and what options, because as a small business, even though we're not for profit, we have the ability to move our employees into the marketplace, and we're going to look at that as an option that still cover all our employees, but we will have the benefits of at least some. Now, for not-for-profit, you can only get 25% of a tax credit, so there will be that. And I think what Lindsay was saying too, and Ray, you may mention too, is that the idea of these private exchanges, it's going to be interesting to see how that plays out. There definitely seems to be a lot of hype out there. Some major companies like Walgreens and some others have mentioned that. So it's going to
The hot trend right now amongst all this, and they're sort of on, they've gone 1.0, 2.0, they're looking at 3.0 is wellness, as you mentioned. I mean, employers realize that a healthy employee population is good for me from an absenteeism, from just a better attitude, better health, and certainly cost. And then employees get it also. The more and more, all these plans you saw had $1,000, $2,000 deductible. That first set of costs is on them. the healthier they are, the better they're going to, and they invest in prevention and things like that. And you saw the other statistics about smoking and diabetes. So they're still trying to wrestle with what the best wellness program is. I think employers understand the value of it. They're wrestling with the uptake. How do I get more and more of my employees to participate? You're starting to see some of these devices. Does anybody have an activity tracker?
Pedometers?
Well, they're
Ours is all
like,
self-reported in the computer.
yeah, they're like pedometers on steroids. One's
Got it.
called Fitbit, Nike has one
Heard
out
about
called
them,
Fuel.
yeah.
And they measure your activity, they Bluetooth onto your smartphone, and you can track, and then you can challenge people who you allow into your network to, I'm gonna do 10,000 steps this week, I'm gonna do 11,000. And employers are trying to see, how do I tie rewards to that? How do I tie
Providers are
less
applying rewards
less
to-
contribution to your insurance premium? Not just you can get a free weekend at Marriott, but I'll put $100 in your health savings account for you. So it's those kinds of things.